Why did we end up finally covering this?
In part because we love our listeners, but then also there was a recent change to the CDC guidelines in 2023. I think it was, Matt, that actually recommended now screening all adults for hepatitis B. In part because it's just so easily preventable, and this is in concert with a vaccine recommendation that all adults should be offered immunization. So it Matt, back when you and I were in training, the indications for hepatitis B vaccination were, I'd have to look them up every time. It was where if you were a healthcare worker, if you had type 2 diabetes, if you had certain chronic
Yeah.
conditions, then you would do that. But now it's just much easier. If you're an adult, you should be offered immunization. And if you're a young adult, you've probably already had it. So it
Yeah.
makes things a little bit easier in that way.
I think the cutoff is, I think it's everybody up to 60, right? And then
That's right.
above 60, it's like if they have diabetes or if they just want a vaccine, they can get it. It's pretty lenient now. But yeah,
Yeah.
like, many of our patients will, like anyone that's exposed to needles, anyone that has chronic liver disease, like most of our patients should just be vaccinated. Now, Paul, we're going to be screening. So what are we doing? Like, what's this triple screen that we talk about?
So the triple screen, you're not going to believe this, Matt, is 3 components. That's how
Oh,
it got its name.
okay.
So I hope that helps. There is, and by the way, I've mentioned this in the episode. I'll mention it again. The boards love this. I don't know why. Like there are tables you can look up, but just so that you know, it's worth just kind of going through the mental process of learning these. So there is the hepatitis B surface antigen, and if that is present, that is suggestive of ongoing infection. Now you can't, with that alone, differentiate between acute or chronic infection. There is the hepatitis B core antibody. So if you have an antibody to the core of hepatitis B, you have been exposed to hepatitis B at some point during your life. So if that is positive, but your antigen is negative, that means you have probably cleared your hepatitis B infection. If you have a positive core antibody and a positive surface antigen, you probably have ongoing infection.